All right. Good afternoon, East Coasters. I hope you had a good morning and ready for the second part of the day. Good way to start it is talking to us at NMQF. The Northeastern folks, I hope you're enjoying the snow that we're seeing come in, the flurries that we're seeing in DC and north of DC. So be safe and careful with the first snow of the year coming in. Today's webinar is, it's Friday at NMQF. So what we do is we try to educate as my our edutain, how we look at it, and the best way we know how we do these webinars every Friday. This Friday is led by our team at SHC, and we're talking about type 1 diabetes in communities of color, insights on screenings, access, and bias. If you know our SHC team there, not only do they do all the research, but they get out there in the community, so they really know this space. And I'm going to just make it really easy and turn it easy on myself and turn it on to their fearless leader, turn it over to their fearless leader, Akia. So Akia, I'm turning it on to you.
Thank you so much, Brandon, and good afternoon or good morning to everyone who's on the call. Thank you for attending our webinar today. I'm Akia Blue. I lead the Center for Sustainable Healthcare Quality and Equity. We're also known as SHC. And for National Diabetes Month this year, we wanted to focus on type 1 diabetes. It's an area where we continue to see many disparities. And in particular, Black and Hispanic patients with type 1 diabetes are often diagnosed later. They're diagnosing diabetic ketoacidosis, which is a life-threatening complication of untreated diabetes. They experience higher A1C levels, experience more barriers to accessing technology to manage their diabetes, including continuous glucose monitors and insulin pumps. And not to mention, they often also experience a decreased quality in care, with many of them being misdiagnosed with or incorrectly treated for type 2 diabetes because of implicit biases. And so to highlight these challenges and more, we spoke with 15 people of color with type 1 diabetes over 2 focus groups about their experiences, and we compiled those learnings in a report, which you'll be able to access on the NMQF website, and we'll also share a link in the chat. We learned about the challenges they face in the management of their diabetes, including the emotional and mental burden and gaps in care. We learned the resources and support that they find most helpful, which often do not include their providers, but rather social media and peer support groups. We learned about their knowledge of the availability of type 1 diabetes screening, which almost 90% of the focus group participants had never heard of. But we're excited to hear about their willingness to participate in clinical trials. And they stated that they need more transparency in order to consider doing so. And their desires for the future of T1D care, which includes systemic improvements and better access to technology and comprehensive care. So in listening to these participants, we learned a great deal about their desires and the things needed to improve care for patients of color. And we invite you to read the report and reach out to us with any questions. Today, we're excited to have an engaging conversation, not just about the barriers that people of color with type 1 diabetes face, but also we want to share actionable, successful tools, resources, and programs to overcome these barriers. And so we have the patient voice featured. One of our focus group participants is on the call today. We have advocates in the space and an endocrinologist to share their perspective as well. And so I want to extend my sincerest gratitude to each of our participants. I also want to thank Sanofi for their support of our focus group and our report. And in closing, I just want to say we do close our report with the following message. People with type 1 diabetes need to be heard. And as advocates, clinicians, pharmaceuticals, biotechs, family, and friends, we need to listen. In the ecosystem of diabetes, the type 1D community, especially those who are minorities, are not elevated enough. And I hope at the end of this conversation today, everyone here walks away having heard clearly how we can all support people with T1D. And I hope you all feel energized to go out and do good work to improve the quality of type 1 care. So at this time, I want to turn it over to Leslie Zuniga Rivas, who is the Quality Improvement and Equity Project Manager for SHC, to lead our discussion today. Thank you.
Hi, everyone. Thank you so much for joining us today. We have a great panel for you guys today. We have Mariana Gomez and Melanie Batchelor from Beyond Type 1. Mariana is the Vice President of Community Programs and Hispanic Relations. She has over 17 years of experience in the diabetes nonprofit sector. And Melanie is the Manager for Health Impact Content and Community Education. She is a registered dietitian and a certified diabetes care and education specialist with 14 years of experience in healthcare. We also have Miss Mila Clark on our panel today. Mila is the founder and CEO of the Hangry Woman and Glucose Guide. She is also a board certified health and wellness coach. We have Dr. Monica Gomberg from Blue Circle Health with us today. Dr. Gomberg is the Vice President of Clinical Care for Blue Circle Health. She is she's also an endocrinologist. And last but not least, we have Ms. Char McCray. Char is an advocate for policy and community engagement, and she is also one of our participants from our Type 1 Diabetes Focus Group, which is the backbone for our conversation today. So here at NMQF, we center around health equity. So I think that would be a great way to get our conversation kicked off today. So Melanie and Mariana, from your personal or professional lens, what do you think is the most important factor in creating equitable care for people with type 1 diabetes?
I can start, Melanie. Thank you. Thank you, Leslie, for that amazing question. I think that, I mean, for me, from my both my personal and professional experience and perspective, I think that the most important factor is creating equitable care for people with type 1 diabetes. And that means ensuring that all voices are heard, which is normally something that we're still missing, and included. That has always been a challenge that we've identified, and especially those from underrepresented communities. I truly believe that equitable care isn't just about providing the same treatment to everyone, but it's rather making sure that the unique needs, the unique challenges, and the perspectives of diverse populations are considered and addressed in the most effective way, but in the healthcare delivery. From my personal point of view, as someone who actually lives with diabetes, that also means actively engaging with the community to understand their experiences and helping, of course, to remove some of the barriers to access. These barriers to access can be many and can be of many types. These can be financial, these can be geographical, these can be cultural, being cultural the ones that have at least impacted me the most from a personal standpoint. And of course, we need to create solutions that are accessible to all. It is also crucial to address bias in the healthcare system, and we need to ensure that healthcare providers have the tools and training that they need to treat patients with empathy and respect, no matter their background.
Amazing, Mariana. And to kind of piggyback off of that, Mariana, you often say nothing for us without us. And I think that that really is the essence of how I would answer this question. And really from a clinical standpoint, we want to implement targeted interventions. And I think that's the key, but we want to do those in tandem and in partnership with the communities that really need the intervention. And so we at Beyond Type 1 focus on creating culturally tailored interventions. We know that there's significant data around these interventions, particularly in the type 2 community. But really, we want to look at that for the type 1 community as well. We partner with community leaders, which I think is important for raising awareness, but also in supporting the community in self-advocacy. And with some of our other programs with those tailored interventions, we want to assure that the program that we offer is meaningful in the most important ways in the community. So again, we're walking hand in hand, and I think that's where you can really see equitable care.
Absolutely. I think it's also very important to remember that every community is different, especially at the zip code level. That's a big focus that we have here at NMQF. But I want to turn over the question now to Mila. Just discussing again that every community, every population is different. I think you do such an amazing job of really targeting communities online. So from your professional or personal lens, what do you think is the most important factor in creating equitable care for people with type 1 diabetes?
For me, from the professional angle, I think that just the access to information is so important. When we walk into a clinician's office, we often only have 20 minutes with them. We might not have enough time to get all of our questions answered. And so we might walk out feeling a little bit lost or feeling like I don't exactly know what the path forward looks like here. And so that's a lot of the content that I try and create for people. It's, meeting them where they are, at that moment where they're first diagnosed and they have a million questions and they don't know what the roadmap for them looks like going forward. And even basic questions, like you would think it's really just so basic to ask somebody, what is your understanding of type 1 diabetes? What do you understand about the diagnosis that you've been given? A lot of people will come back and say, well, I really don't know. I just know that I have diabetes. I know there's something wrong with my blood sugar, and they don't know really the whole scope of it. And so it's almost like dialing back to really the foundational information and getting them to understand that information first. And that really can help them build the confidence to be able to manage diabetes as a whole and do it in a way that works best for them and isn't a cookie cutter process, because we know that diabetes is so different for everyone. From a personal standpoint, as someone who was misdiagnosed with type 2 diabetes for 4 years, one of the things that I found was that it really comes down sometimes to biases. And that, you know, a clinician might look at you and say, well, you do have a family history of type 2 diabetes, you are overweight, this kind of makes sense in this pattern. And I think sometimes the surface level and what's most obvious for a patient is probably the easiest answer. But then I always think, like, it should have never taken 4 years for someone to take me seriously. It should have been me walking in and saying, my A1C is still 13%. I still don't feel like I can function every day. We tried oral medication and this isn't working for me. And having that be taken at face value, I think sometimes implicit bias can also play a role in the way that we're treated. And so, especially in communities of color, we can walk into a clinician's office and we could be the most educated, have the most resources, have, you know, all of the insurance in the world ready to go, ready to be like, okay, I'm ready to take on whatever treatment plan, but we can still be looked at as, you may not know really what you're dealing with, or you might not understand what's going on here. One good example I can give is when I first asked for a continuous glucose monitor about 2 years into my diagnosis, my healthcare provider looked at me and said, you don't need that. That's going to be too much information. It's going to be overwhelming for you. And meanwhile, it was overwhelming for me to prick my fingers 7 times a day to learn my blood sugars. So it's sometimes just being met at the very basic level so that you know, like, what's happening on the foundation, and then you have the ability to better advocate for yourself, because you don't have to just take an answer for the answer that's given. You can ask more questions and dive a little bit deeper. And I think that's something, the gap that we have.
Absolutely. Well, I want to commend you also for just, you know, being such a great advocate. I know that's something that you shouldn't have to fight so hard for, but I commend you. That's definitely, you know, something admirable. And I want to turn the question over now to Dr. Gomberg. So from your personal or professional lens, what's the most important factor in creating equitable care?
Thank you so much for having me. And the answers have been really so incredible so far. And to add to that, from where I stand, to me, one of the things that we need in order to provide equitable care is standardization and accessibility of care. And I couldn't choose one. These two things go hand in hand, and I think they're very critical and important. And standardization, I think, is just one really important path to bypass even implicit biases that exist. And I think it's something that we can do in the healthcare industry to really take a step forward and standardize what we're doing and how we're doing it, and make sure that it is accessible and equitable for everyone. And I also want to be sure that as an endocrinologist, when I say care, I want to be very clear that I don't just mean medical care, and I don't just mean the endocrinology care in the clinic. I think that there is a huge gap here between everything else that a patient living with type 1 diabetes needs and what I can provide as an endocrinologist in the office. And type 1 diabetes is unfortunately really the poster child of what is needed to improve this healthcare industry in our country in general. And so care, in my eyes, is accessibility to proper education, to preventative monitoring, not just sick care, not responding to DKA in the ER, but working with patients and providing them with the care that they need, to get them at their goals, to respond to all the questions that Mila just talked about, and to make sure that we're hearing and listening to that. In financial support, or at the bare minimum, to start at the breakdown of price gouging medications, of a life-sustaining solution. Like it's a terrible place to start, and there's a lot of work that we need to do there. And I think the other part of it too is just access to the most basic needs. I, as an endocrinologist, can sit in a room and talk to you about whatever your goals are, but if you can't have the power in your home to plug in a refrigerator to refrigerate your insulin, to therefore take it and sustain yourself and keep yourself out of the ER and DKA, and out of being slapped with thousands and thousands of dollar bills from that hospitalization, like what good is my appointment? And so there's so much work that we have to do to bring that care to the community and to all communities, even mental health care. But I think a supporting surrounding community at the very bare minimum, including all of these things, is really what we need, accessibility to all of that.
Absolutely. Thank you so much for those points. And I think all of you have shared kind of a common theme of really also just tailoring care, but also remembering that person, they're still a person. And looking beyond just not the medical care, but what are the social determinants of health? What is the health drivers, like, in a way? And I want to turn the question over now to Char. So Char, from your personal or professional lens, what is the most important factor in creating equitable care?
No, I think so far everyone has hit the nail on the head. Based on how I feel personally, I was one of the focus group participants, and I was diagnosed with diabetes in 2004. And back during that time, it was kind of pre-social media. We had MySpace, right? There wasn't a huge Facebook presence. I don't even think Instagram existed. And I think for me, not seeing people that looked like me really mattered. And it really made me feel like, is this really what's going on with me? Like, so for me, like back then in 2004, it was really about seeing the images of the folks that looked like me would have made an impact for me in my life. As I'm older now, 20 years later, I think filling that gap of I've been diabetic for 20 years, understanding kind of how to live life is an important gap for me. Like, when I was first diagnosed, able to drink, understanding how to balance my life while living in DC, while seeing other people go out and live their adulthood would have been important. I think at different stages in my life, I got to different points where I noticed that there were gaps in what I saw versus what my experience was. So back in the day, when I first saw Nick Jonas with an Omnipod, I wanted the Omnipod, but it was expensive in 2004. Luckily, I was able, and I had insurance to cover it, but meeting me in that affordability gap, right? But also, it was only Nick Jonas and a lot of people that had the funds to have that. So I think from like first diagnosis till now, it was really about me feeling like, hey, this is what exists right now. How do I access it? And how do I have a doctor that will actually put me onto this instead of me finding out about it watching Disney Channel? Or now that I see folks outside drinking and they have type 1, I see them with a CGM on their arm. I'm asking them how they're doing. So it was never that one-on-one conversation with my doctor about how to fill that gap. It was more so me learning kind of through experience, seeing things online, seeing things through just living everyday life. So to me, like, that conversation would have been better had if someone saw me for me and met me where I was and was able to help me navigate those gaps. So for me, it's about the navigation of those gaps.
Thank you so much. And I'm glad that you're bringing up so many points of where you're accessing your information, because that's actually one of my next questions. And that's definitely a common theme that we heard throughout our focus group, is just people just feeling like they're in the dark or not having a sense of community when they're initially diagnosed. And I'm glad that so many of you on this call are able to create those safe spaces. And I'm glad that, as we, move on into the future of everything can also just be virtual, but it's nice that we have somewhere to have a safe space. But overall, I wanted to also ask, where do you typically find the information that you need to manage your care? Do you typically find that through online, like you're mentioning, or any other resources that you're able to access?
So right now, I mostly find it online. So I actually follow a few different pages like Diversity and Diabetes. I follow Beyond Type 1. I also follow your page, Mila, the Hangry Woman. I follow you as well. But I find a lot of my information online in general, like uh it beyond that, like it's through word of mouth. So I'll see something on TV and I'm like, well, what is this? I never heard of this thing. So then I start going on deep dives and mostly I will say my major source of information is Instagram though. Instagram, when I go on Twitter, I find information there, but those are my major sources in following people that look like me that have this similar experience that I have has been my best way to navigate. Even finding out that like Dexcom has an over-the-counter CGM right now. Who even knew that that existed? I found that out literally 2 days ago. So I'm like, all right, like what does that look like? Is that something that I can tap into that's more affordable? These are questions like I don't have an appointment for another 4 months. I can send my doctor a question, but if I send that question, am I going to get charged for it? And navigating that process is a whole nother ball game. But I mostly get my information online. And then I go to my doctor with that instead of it being the other way where my doctor comes to me with that information.
Absolutely. Well, I'm glad that you've been able to, learn at least how to navigate and that we have these resources that we have nowadays. And I'm excited to see, the role that social media continues to play, not just in this area in general, but just overall in public health. But I know something else that you brought up and some of our other panelists have brought up is advocating. So when it comes to your own care, do you feel like you have had to advocate for yourself to get, overall resources and answers that you need?
Yes. Like yes in all caps. From going to the doctor, like it's almost like you have what I think most folks refer to as white coat syndrome, where you see the doctor and you have that immediate anxiety because you don't really know kind of what response you're going to get. So for me, like I've had to advocate just to get answers. Like if my doctor is prescribing me something different, I've had to ask questions and then understanding that, hey, like, I don't know if this me kind of pushing back because I normally go into appointments doing my own research, right?
Mm-hmm.
So I'll know what exists. I'll know the landscape. I'll go into the appointment. And if a doctor tries to prescribe me something different that may not be insulin, whether it is a GLP-1 medicine like Ozempic, right? Like I've had doctors try to prescribe me both insulin and that. And I'm like, I need you to explain that, but you can't in a 20-minute appointment, right? Like you're telling me I need both of these, but how are they going to interact with each other? Like, can we talk about this a little bit more? Let's pull that thread. And I've had to advocate to try to make sure that I get those answers. And when I don't, I'll leave an appointment and I'll be more frustrated than when I went to the appointment that I know that I needed to go to get a renewed prescription, right? So I think sometimes when it comes to going to the doctor, when it comes to being in these spaces, I don't know that doctors understand kind of, hey, some folks may know where they are. They may know what they need and they may know kind of what steps they want to take next. But some folks may not. And I think the biggest thing I've always had to advocate for was understanding where I am. Like meet me where I am so that I can make sure that I'm healthy, make sure that my A1C levels are within the right percentage. And I think a lot of doctors do not really come to you in that mindset. It's really, you have 20 minutes, come in, let me do these bare minimum checks and make sure that you know exactly what you need. But it's from their lens of being the doctor instead of coming to me from my lens as the patient, understanding what I am looking for. So I've always had to advocate in different perspectives in different ways just to make sure that I'm heard every time I'm in the appointment.
Absolutely. Well, I think you're also bringing up great points of just needing anybody, you know, in the medical field to meet you where you're at. And I think that's something great that all of our other panelists are, you know, really centering their work, their advocacy, their projects, you know, all of their outreach. And I think something that I always want to think about is, again, social media and the spot that it has nowadays in public health. And I especially, you know, think to Mila when I when I think of all these like safe spaces that we're creating as we move through, you know, just being able to create access and resources. But Mila, as somebody, you know, who's not only creating all of these resources, but you're also living with type 1 diabetes yourself, what barriers have you noticed that individuals face when seeking information or resources, and how do they vary across demographics, that being age or race or ethnicity?
I think a lot of times what I see is that people are just overwhelmed. Like, we live in this age where Google is at our fingertips. And so you can Google anything. And so if you Google type 1 diabetes, typically, or diabetes in general, what you see is death, amputations, heart attacks. You see all of these very serious comorbidities that exist within living with diabetes potentially. But then you don't really get much information about, well, how do I actually live with this? Like, I'm hearing all the scariest things. And so this makes me not want to dig in deeper because, like, I don't want to know. Like, I would rather just like see what happens rather than really understanding. And so I think some of the barrier to even getting the basic information is fear. And it's, I don't want to learn something that is going to be detrimental to me, and that might put me in a negative headspace and make me distance myself from this thing that I do really need to be on and taking care of. I also think that I think, you know, Char said it very, very perfectly, that when you don't have enough time to be able to sit with your physician, like especially if you're meeting them for the first time, you're seeing someone new, you know, that's really like a moment of triage. Like, they're trying to get to know you, they're trying to get as much information as possible and trying to do the best that they can, but you might have 100 questions. And so that's where I love my role as a health coach, because I can really look at the evidence, I can look at studies, I can look at the information that's out there and really educate someone one-on-one and meet them where they are and really ask them, you know, what questions do you have? I think Char's example was perfect. Like, okay, I'm being prescribed a GLP-1 aside insulin. What is that actually? And so we can have a conversation to talk about really what this means, how it reacts in your body, why your doctor is asking you to take it. And of course, we don't talk about dosing, we don't talk about how to take the medication, but we can go over the basic information. And then I can help the patients that I'm working with form questions for their healthcare provider. And so that they can go back and become more educated about why they're doing what they're doing and just have that baseline. I think a lot of times also, you asked kind of about like race and ethnicity, and sometimes like the age of, you know, when you walk into the doctor's office and where those gaps of information might show up. And I think that happens a lot to young people of color. Oftentimes, and I can't speak for everyone, I can only speak from my own experience, but I've walked in knowing that like I'm smart, I'm capable, I can understand. I have good questions, I came prepared, and then I'm still treated kind of like you don't really know anything. Like, obviously, if your A1C is so high, like clearly you have no handle on this, you know. And so even walking into a setting where automatically you are feeling like, okay, I'm immediately going to not be taken at face value. Someone's going to look at me and have whatever bias they might have. And then like, I might not get my questions answered, or I might have to fight on a point where I didn't think I was going to have to justify why I'm asking for this thing or why I'm having a question about this. And so I think that, you know, our doctors do the best that they can with what they have, like, especially in the US healthcare system. We just live in a system that isn't necessarily accessible, isn't always patient-centered, and is trying, but is not quite there yet. And so I think the more that, you know, like professionals that can support diabetes can also be there to help our doctors and our clinicians. That really takes the load off of them, but then also gives the patient some power and also some support along the way so that they're not alone in this journey. And again, that takes resources like seeing a specialist, seeing a diabetes therapist, or you know, seeing a health coach or somebody who's going to help you stay accountable along the way. It's obviously extra resources, but it's some of those things that can get you on the right track and help you along the way. And really take some of the burden off of clinicians who are trying to do like the acute care and really help you manage the chronic part of your disease.
Absolutely. And I think that circles back to what Dr. Gomberg was mentioning earlier. You know, your care team isn't just your physician, whether that be your endocrinologist or your primary care physician that, you know, is overall anyone that you're getting your information from, or anyone even that can help you advocate for yourself. And I think that's something great that Beyond Type 1 has been able to do, is just overall this great campaign work that they do to just to bring awareness to everything, you know, and above for beyond type for people with type 1 diabetes. But something that I want to mention to our audience today from our focus group, you know, we really wanted to get an overall view of everything from their diagnosis story to screening to, you know, their outlook on their future for this area. But when we were trying to get insights for screening, we had to take a step back because not many of them were even aware that type 1 screening for type 1 diabetes existed. So again, I think that's something great that the ladies here at Beyond Type 1 are able to do, is you know, bring that attention, bring some attention to that. After, you know, we were able to provide this information to our focus group, all of them, you know, came to the consensus that screening is not only important for avoiding serious health complications, but also in reducing financial barriers. So Mariana and Melanie, from your perspective, what are the biggest barriers to increasing awareness and access to screening?
I think that there are several barriers, some of which we have indirectly discussed this morning. For example, the language barriers and the cultural barriers are some of the things that we're focusing nowadays more than what we did in the past. For the Spanish-speaking community, for example, we tend to see that we are still generalizing the Latino population. And it is thought that as a Latino, we're all the same kind of Latino, and we speak the same Spanish in the Latino community, and we have the same behaviors and the same eating patterns, and that's just not right. We need to create and we need to tailor our information and our resources in a way that we feel related to them. And that means, as I always say, co-creation. We need to identify and to work very close with our communities just to identify what our needs are exactly. And in this case, for example, type 1 diabetes awareness, our communities know about type 2 diabetes. We do have a lot of knowledge, and we have personal insights because our own race and ethnicity makes us to have a higher risk of developing type 2 diabetes. But however, and sadly, we do not see that many cases of type 1 diabetes for many reasons. The financial burden that this represents, the lack of access to the healthcare system that will diagnose type 1 diabetes on time. So we lose a lot of people, and we're not able to hear from them, and we're not able to build upon their stories. So we need to co-create with them to use the storytelling component. And that is something that at Beyond Type 1, we kind of do very well. We use these stories to help people understand and feel related to them so that they can start building for their own sake. Social media has been a huge impact for most of us. We still need to find more people, more Spanish speakers in the diabetes space so that we can keep working on those resources. The diabetes online community has been amazing for most of us on our own journeys with diabetes. And there's not always someone available to translate those messages in a way that resonate with us. And that's something that we still need to do. We have also identified that most of these barriers, the cultural barriers and the language barriers, can also turn into psychological barriers, and we need to address those issues as well. So as Char was mentioning, it's not just about caring for people with diabetes, but it is actually holistically caring for people with diabetes. We need to use the story component. We need to build awareness. We need to prescribe social media. Not everything that we find in social media is relatable and is reliable, and not everything that we find there has been culturally translated or culturally is not going to be culturally adequate for our populations. So some of the things that we've discovered throughout the time and the years is that we still need to work more on these accessibility challenges, but especially the cultural and language barriers. I think that that's something that we still need to work more on. I truly believe that that working together, not only as organizations, but as people with diabetes and as advocates, we will be able to tackle some of those barriers. And as we know, type 1 diabetes, it grows every year in the United States, and that includes us Spanish speakers, and that includes also pretty much everyone. So we still need to create more assets that will resonate with our communities. Type 1 diabetes is not preventable yet. However, there's a way that we can raise more awareness and we can share with our communities to help them share with their own people as well. It's not just us sharing that information, but it is actually, and then again, and I'm sorry if I sound like a broken record, it's like co-creating with them. We're training the trainers, we're training the community, we're helping them get their messages far. So that's something that we've been doing for the last couple of months. This year we launched Beyond Barriers, which is a health equity program that is exactly doing that. We're co-creating with our communities. We're recruiting ambassadors. We're sharing stories. We're raising awareness on different topics. And those are some of the things that we feel are still going to happen and that we still will need support with.
Yeah, thanks, Mariana. And we at Beyond Type 1 we try to be very solution focused, and you can see that in the passion that Mariana has. And we're going to talk about some of those things here in just a little bit. But in terms of just the barriers to awareness and knowledge about screening for type 1 diabetes, we actually in March of this year conducted a survey in partnership with Sanofi, and we asked 1,000 adults and 1,000 primary caregivers of children with type 1 diabetes some questions, and one of the questions really focused on barriers. And what we learned is only about 14% of adults were screened before a diagnosis. And so this survey wasn't specific to any one race or ethnicity or age group. It really was kind of all encompassing. And so across the board, that's what we're seeing. But in terms of awareness and access, we really boiled it down to three things. The first being lack of awareness, the second being limited insurance coverage, and the third being provider hesitance to even offer screening or do the screening when it was asked about. And I know that we've really talked about that already. Like, we have to advocate for ourselves, but then we also have to have that provider knowledgeable enough to then respond to our ask. And so, having some data to drive what we do and understand what those barriers are, I think is really, really important. Within that survey, we also asked a lot of other great questions and had learnings around regrets of not knowing soon enough, the impact on emotional, social, and financial health of not being screened or not knowing early enough, and really what's needed for support of that early detection. Again, we'll talk more about that a little bit later.
Absolutely. Thank you so much for sharing those perspectives. And since we're in the topic of just screening overall, I want to take a step back and ask Dr. Gomberg if you can give us a quick brief explanation of what type 1 screening looks like and what the process typically looks like overall, since we have a pretty diverse audience here.
Yeah, absolutely. I'm happy to talk about that. So most screenings in general in this country are typically aimed toward those with a first or second degree relative of individuals living with type 1 diabetes. That being said, so if you have a relative living with type 1 diabetes, you're 15 times more likely to develop it than the general population. However, we need to take a step back because 85% of people diagnosed with type 1 diabetes do not have a family member. And so the screening that we're doing is really, really important and really incredible. And there's a movement now, and I know there's lots of agencies involved in this, there's a movement to expand this to the general population, and that's the reason why. But for those who are identified as being at risk, having a family member, or those interested in general screening and can have access to that, which I know is part of what I'll talk about too, they can go to their healthcare provider, though hearing the panelists and experiencing from what my patients are telling me, that requires your healthcare provider to have the knowledge and the willingness to go ahead and do that. I think that there are incredible resources that you can access and that we can link in the chat here on accessing screening yourself from the comfort of your own home. Screenfortype1.com, trialnet.org, Beyond Type 1 has a link, Breakthrough T1D has a link. All of these resources are there and will take you to websites to be able to get access directly sent to your home. What that means is you can have a shipment sent to you for free. It will require a finger stick and some blood drops on a piece of paper that you then can send for free back to the lab testing, where they can test the antibodies and determine the antibody risk, the antibody presence, and determine if you're at risk or what your level is for T1D. I think it's also important for me to say that this is a very important and personal decision to make. The reason why I believe that screening is very helpful is that 50%, half the people who are diagnosed with type 1 diabetes present in DKA. That is scary, that is stressful, and my goodness, that's expensive, right? Like, that is something that if we can avoid, it would be a huge paramount shift, dynamic change for people in their diagnosis. It would eliminate the PTSD, the trauma of the diagnosis. And so I think there's a really massive advantage to that. And we acknowledge that screening, that you now know that there is a risk for you, and living with that knowledge is really, something that people have to understand. The opportunity is there to get involved in clinical trials. The opportunity is there to have disease delaying treatments, and more are coming out, and more research is being done on that. And I think we have the opportunity. I was just talking with Dr. Sarah Weston earlier today, who is a psychologist in the field of T1D, working on how to talk about psychology and therapy in the patients who have screened positive, and trying to make sure that we're addressing patients and meeting them where they're at and figuring out what they need in every step of their journey. But the testing itself, I know that was your question, so that's the screening and how to go about it. And again, we can link some of those resources in the chat for those listening.
Thank you so much for sharing those resources. And I want to close out our conversation on barriers. We obviously want to bring light to all of these barriers, but we also want to talk about the great work that everybody's doing to be able to, overcome these. But from your side, Dr. Gomberg, what are some of the barriers that you face as a clinician to be able to provide, appropriate care? I know something that comes to my mind is just the ratios of the endocrinologists out there versus the people that need to access an endocrinologist, and also navigating prior authorizations.
Yeah, so I think you say the word prior authorization, and everyone, no matter where they stand, feels the pain and the stress of that. And I know how stressful that is for patients. Where I stand right now at Blue Circle Health, which I can talk more about, but we intentionally created a program that removed barriers for patients and clinicians alike. And I truly believe that in order to get the best possible care from your healthcare provider, you can't have it from a burnt out and unsupported physician. And so I think there's a lot of work to be done in the healthcare space. But to specifically answer what you're asking, let me take you back a few years in my life where I was working in traditional healthcare and providing clinical care. And were my patients benefiting? Yes, I saw a clinical benefit, of course. Was I satisfied? Frankly, no. And the reason for that is because there are so many barriers there, and there are so many overwhelming issues that we face in terms of wait times for patients. I would love to see my patients in follow-up, but my wait time was excessively long. And reimbursement criteria. The healthcare systems are created in order to keep their doors open, and therefore they have to work in the criteria and say, well, I have to follow these durations of follow-up, the length of the appointment, because that's what is reimbursed in our society. And no matter which practice they went to, patients were finding it's the same thing. But I think very importantly, there's more to type 1 diabetes care than clinical, as I was saying before. And so I think, to me, that's the biggest thing, was being able to provide their most basic needs, the peer support, the education, the counseling, and having those things right now at Blue Circle Health has the greatest impact on me. But not having them and seeing how patients in the traditional healthcare system didn't get the benefit of all of that and couldn't get, couldn't advance in their T1D goals and what they're aiming for, because all I was able to provide was 20 minutes to them, in which I was checking off a bunch of boxes. It was unsatisfying to the patient. It was not getting at what they needed. I couldn't answer their questions. I was frustrated, and that's nothing. I can't imagine the frustration that my patients were feeling. And so that really is the most overwhelming part of all of that to me. And I think in order to develop these trusting and long-lasting relationships, we have to come to a place where we understand that there's more to it than that. And that's what we're working for here at Blue Circle as well.
Absolutely. Well, thank you so much. So I think it's important to, remember that these barriers aren't just affecting, the patient, the person necessarily, but it's, it starts at the top of seeing who's providing this care and what their barriers are as well. So thank you for bringing those to our attention. But something that I want to turn our conversation over to now is the solutions and what the great work that everybody on this call is doing to, not just provide resources and awareness, but, just access to needed care. So here at NMQF, we really like to, obviously bring attention to inequities and barriers, but we're also about action. So Mariana and Melanie, if you could share some of the great work that you're doing. I know we have a mutual community partner, which is the Friendship Baptist Church in Chicago. They're a part of our Faith Health Alliance, and you've been able to partner with them and provide some great information to the people out there.
Yeah, for sure. So I'll kind of give some general information, then I'll let Mariana talk specifically about that group. So at Beyond Type 1, we are really focused on not only the awareness component, but providing screening in the communities that need it most. And so we've actually hosted a handful of free screening events in Detroit and Atlanta. We've screened almost 200 people, and we've seen 8 plus, still waiting on some more results to come back, but positive tests come back from those screenings. And so, now those people are empowered to avoid the DKA crisis and the expenses and emotional things that come along with that. We also have an ambassador network, and this is almost 4,000 people strong across the United States and other countries. And we really equip them and our community partners with a lot of information. And we offer guides that support discussion around early screening, and specifically talking to their healthcare provider about it. So here's what you say, here's what you ask for. And then what do I do if I have a positive result? And so we want the information to be clear, accessible, and really share what is the most important locally. And so Mariana will talk about our Beyond Barriers program and working with the church.
Yes, actually in 2023, as I mentioned, we launched Beyond Barriers. And Beyond Barriers is our health equity program. And this program targets diabetes awareness and support in specifically these underrepresented communities. We have been working in different locations to launch not only culturally relevant campaigns, but also creating these partnerships with local organizations. Once again, co-creation. And the idea is to amplify reach as well as creating tailored events, as Melanie just mentioned. And this program has been created with 3 pillars in mind. It's awareness, it's access that includes providing self-management and early detection resources and support through community building. Through this new program of ours, we're looking into ways to elevate innovation through social investment in partner organizations. So this year, for example, we were able to give away some grants across different health equity cities. Those were Miami, Detroit, and Chicago. And these grant recipients were community-based organizations, federally health qualified centers, sororities, and churches. One of our grantees, as Leslie, you just mentioned, is the Friendship Baptist Church. Our work with the Friendship Baptist Church has been not only a great learning experience for me personally and professionally, but also has been a true example of what we should be doing, like everyone should be doing. We're co-creating with them. Tasha Berry Lewis, who is the lead for that initiative, she's a great ambassador of ours, and she's actually helping us to gain the trust in the community and create these elements and these resources with them. So a couple of weeks ago, we had an event there at the church, and it was an amazing experience because we were able to prove what we had already learned through our surveys. For example, we knew that people were knowledge on type 2 diabetes, but sadly, they did not have a clear understanding of type 1 diabetes. This was an older population, the one that we visited, and we had to create and specify and make sure that our language was tailored and created for them. So we use motivation as a tool as well. Do you have children? And most of them say yes. Do you have grandchildren? And most of them say yes. So we kind of use their personal experience and their personal approach, not only to their families, but also the way that they live in their communities to make sure that we were providing this information. We actually provided resources and materials not only to create awareness, but we want them to bring these resources with them. We really believe that in training the house trainers or training the community members, we'll be able to spread the voice and spread awareness. So it's not only working with one church, but it's what we call the ripple effect. We know that these community members and these churches will spread the voice in their own neighborhoods and potentially will have this information in many churches. So that's something that we've been doing this year, like just working with some of these organizations. Community-based organizations are probably the ones who need our support the most. And as we've always been saying, we need to find them where they are. And that does not necessarily mean and exclusively mean the part of their journey with diabetes that they are, but it can also mean geographically where they are. So that means in some cases, us traveling to them and us providing these services and us sharing that information and us sharing our resources so that they can use them in a better way.
Absolutely. Thank you so much. And I'm happy to see, overall, that's a big part of the work here that we do at SHC is partnering with people, where they're at in communities. Yeah, I always say they know their population the best, they know their community the best. So who better to lead this great work? And I know we're coming up on our time here, but Shar, how do you think healthcare providers or organizations can better support people, navigating the early stages of their diagnoses?
I think one of the first things is really, really, really making sure that people understand what it means, but know that you can live with it, right? Like, I think that was one of the lessons that from diagnosis, I was diagnosed in DKA. So for me, going to the hospital, seeing my family cry around me, not really knowing that you can live with it. Like, you can live with it, you can thrive with it. I think creating it in a less fearful state is very important in those early stages. You do not have to use scare tactics to really like get people to understand that you can live with it. And I think Dr. Gumberg hit it on the head when you spoke about like just making sure that people know like this holistic state. It's not just about the clinical side. It is about the holistic part. Like, you can still go play sports. You can still live your life. And I think for me, in where I am now, if I would have known back then, you could live with it, you can thrive with it, and you can also have some fun as well. I think that would have changed my initial diagnosis trajectory from a less saddened state to more, hey, like feeling empowered. So.
Exactly. Well, thank you so much for sharing that perspective. And I think that is a great segue for Miss Mila to bring up the great work that she's doing. I think you do such an amazing job of not just bringing resources, but also focusing on empowerment. So as your closeout question, and obviously, you know, giving you some time to share your work, how do you approach creating content that feels relatable, especially for those that are feeling overwhelmed with their diagnoses?
Yeah, I think one of the things that people in my community hear me say is just one thing at a time. And so we can get this diagnosis, we can be overwhelmed with the way that like our life has just completely changed one day to the next. And sometimes it's just about taking that simple first step and then taking the next step and the next step and the next step. And then it becomes second nature and it becomes a lot easier. And so sometimes it's just about focusing in on the immediate rather than thinking of like, okay, how is this going to affect me 10 years down the line, 20 years down the line, and just saying like, how is this going to affect me today? And what can I do today and right now to make sure that I'm in the best place possible? And then how can I keep replicating that day after day and really embracing this new life that I have to live with? I think one of the worst experiences that I had in healthcare initially was the conversation around food. My family is full of beautiful Jamaican people, and we love our Jamaican beef patties and our oxtail and our jerk chicken and our rice and peas. And when I talked to a dietitian for the very first time, I told her, these are all the things that my family loves to eat. This is like the things that I love, but I also love steamed cabbage and greens. And she basically said, you can't eat anything except for the steamed cabbage. And even that, you're probably going to have to like really alter the way that you make it so that it's actually healthy for you. And it was such a discouraging conversation, especially because I love food. I love cooking. My family loves food, and it made me feel really deflated. And so I wanted to create resources that really spoke to food joy and to knowing that you can still live a good and healthy life with diabetes. You can still balance your blood sugars, but you might have to take a different approach to doing it. It doesn't mean that you have to eliminate all of the foods that you love and only eat kale every single day to balance your blood sugars, because that will never make you happy. But it's about finding out what works for you. And so it was really important to me to have resources like that, and to use my food science background and really learn to make recipes in a way that could be beneficial for me because I'm also balancing my blood sugars, but that other people could also enjoy, and really doing that around different cultures. And then I also created a second resource called Glucose Guide. It's an app on iOS and the Google Play Store, and it's a peer support community. Of course, I'm the lead coach in the community, so I work with people kind of where they are. And it's a way for people to really understand each other, find that support. A lot of people who join say that they don't know anybody else with diabetes and they've never felt comfortable talking about it because they feel judged, but they know walking into this space that it's an inclusive and judgment-free community. We don't judge how anybody else manages their diabetes because it's their condition to manage the way that they want, even if they do differently from us. But it also has become a really fun space of just engaging conversation around diabetes. And so we have like a group chat channel where it's just members sharing their fasting blood sugars in the morning because they're like, oh, I hit my target, I did really well. Or like, I still need to work on this. Do you guys have any tips? We also have live events every single week. And so as a community, we get together and we do an educational event that's like 15-minute kind of presentation from me about topics that people have asked about in the community. I research them. I find the studies that really talk through like why these things work or don't work. And really kind of break it down into the patient perspective, like just something that's easy to understand. And then we have 45 minutes where we all sit down and we can just have a conversation and talk about the topic at hand. And so it's a really nice free space for people to be able to communicate. And then, yeah. And next year, so there's a question about, I saw in the Q&A about cultural foods and really being able to help people understand how cultural foods can fit into their diet. And that's a question I have had for so long in my work in recipe development, but also just nutrition education. I'm getting my master's in nutrition currently, and it's been something really interesting for me to learn is really just like how the human body processes food and that kind of basic end of the science. And so one of the things that I have found is that the science sometimes doesn't meet the education. And so people don't know the science and they maybe heard a word like a carbohydrate or a protein or fat. They don't really know what that does to their body or why it matters or what it means. And so next year, in the first quarter of next year, I'm launching a nutrition app that's like companion to Glucose Guide. And it has the ability to scan barcodes so that you can see the macronutrient breakdown of all your food and then actually what those things mean. And then it also has the ability to scan your plate. So if you have like a plate of rice and beans and chicken and I'm just going to say guacamole because I'm thinking about like a burrito.
Yes.
You can hold up your phone to that plate and it'll give you an estimation of what the nutrients of that plate are.
That's amazing. Do you have the resources for that we can put in the chat as well?
I don't have it yet, but I will once it's live and once it's ready. I'll post it I'll type my links in the chat as well.
Oh, amazing.
But it'll
be sure to share those out with we'll share the chat with everybody on the call as well. And I'll want to hand it over to Dr. Gomberg to close us out and share some of the amazing work that Blue Circle Health is doing. So everybody can, direct their patients and communities to them.
Thank you, Leslie. And I'll talk quickly, but we talked a lot in the last hour, right, about reasons why I believe and why we all believe that T1D care is not optimized in this country, and far from it. Screening is incredibly vital and it sets people up for success and support. But let's be clear, with increased screening, you're also going to put more and more people into a system that is set up for inequitable and suboptimal care. And that is what we see in every state at Blue Circle Health that we go to. Blue Circle Health was created to be a free T1D care education and support program specifically addressed to close that gap and to bridge that gap for all patients that we're seeing. 60% of our population identifies as Hispanic or Black. 20% speak Spanish as their primary language, and many solely Spanish speaking. 20% are uninsured, and many have an unknown citizenship status, because it doesn't matter to us who you are and where you are in order to provide you the best possible care that you deserve. And so at Blue Circle Health, we have endocrinology care, insurance navigation, a diabetes supportive counseling, case management, education and nutrition, peer support, and group sessions with support to meet one another and learn from one another. All of our services are free to patients thanks to the Helmsley Charitable Trust. And because of this, we have this incredible opportunity to flip healthcare on its head and to say it doesn't matter to be what's reimbursed, and therefore I'm setting it up because it's the only way that we can pay our bills. Absolutely not. We're setting this up because we are setting it up in the way of addressing what it is that patients want and what they need. And we are listening and we are learning all of the time, and we are committed to making growth and feedback and change. And so I hope that you join us, bluecirclehealth.org. I really hope to meet you all there, and we're spreading across the country. So if we don't exist in the state that you are, my hope is that we'll be there very shortly. So I really appreciate this opportunity, and I hope the chance to meet you all.
Yes, thank you everyone so much. We'll be sure to share the resources that were in our chat as well, and we will be posting this recording to our YouTube channel. But I want to thank you all for the great work that you're doing, and I can't wait to see what else we we do in the future. Bye. Thank you.